Let's go down to Dr. Elaina George. Is a board-certified doctor and author of the book Big Medicine. Dr. George, the new Congressional Budget Office estimates show that the recent revisions to the Republican health care bill would still leave 14 million more people uninsured by 2018. Any surprise there?
No, not really. The bill does a lot to help people in the short term. First of all, by letting people who can't afford it leave it without being taxed or fined, getting rid of the massive taxes within it, especially the one for patients who have PPO plans, which are the best insurance plans. They used to have a 25% surcharge tacked on to their policies, and that's a great thing that it's gone. But ultimately, I'm still concerned that the cost curve, the thing that's driving healthcare costs in the country, are not being completely addressed. And I'm hoping that the negotiations, as they continue, will start to put more pieces into place to help patients really get cheaper health care. That's what it's all about for everybody.
Dr. George, as a doctor, do you think that Obamacare should be repealed and replaced?
If it were up to me, I would absolutely repeal it. It hasn't helped the practice of medicine at all. I'm a self-independent doctor, and when Obamacare passed, I went from seeing about 15 to 20 patients a day to about 2 a week initially, because people were so outraged that they had to pay out of pocket, out of cost, in addition to their premiums. And it took a while for our practice to bounce back. And we've seen a change in the whole healthcare delivery system because of this. There used to be 60% of independent doctors practicing. We're now down to 30%. Doctors have sold their practices to hospitals because they can't afford to stay open. And unfortunately, that's driving the cost.
Doctor, one of the things the Republicans are doing to try to bend the cost curve is to say, all right, insurance companies should not be forced to cover people with pre-existing conditions. I assume that you have some patients who may have pre-existing conditions. What will you say to them when their insurance company says, you know what, they're too expensive, you don't have health insurance anymore?
Well, actually, I don't think it's as black and white as that. I think that the states can have risk pools where the people who have pre-existing conditions can have it covered from an alternate source, as opposed to the main pot. Only 5% of the people in our country have chronic diseases that are really expensive. And I think if we found another avenue to pay for that, it would drop the rate for a majority of the other people.
All right, Dr. Elaina George, we appreciate you joining us tonight.
Thank you so much for having me on.
You're welcome. I-24 News just got an exclusive interview with